So I approach it, this is the concept, is just to microvascular surgery cannot solve this problem. So I approach it. This is the lymphedema collection of the lymph sludge. So I can doing by likewise liposuction can heal, can reduce the volume, and then the lymphatics can be regenerated by stem cell. So you see. So the pathophysiology of lymphedema is cell hypoxia, ischemic change. Toxic lymph sludge collection decrease the immunity, so very easy to develop the lymphangitis and the fat hypertrophy. Due to the fat itself is engulfed of the toxins, so it become more bigger than normal fat, and the lymphangitis, and now the chronic inflammation making a fibrosis, progressive subcutaneous fibrosis. You see, the fat cell lymphedema always accompanied with chronic inflammation. So lymphostasis, pathophysiology, lymphostasis, paralysis, ectasia, pelvic incompetence, muscular dysfunction, lymphedema, and the chronic inflammation, fibrosis, and then finally, very small, but it can be developed into cancer. So I make a diagram. The first stage of lymphedema, lymph fluid collection. This is very well controlled by CDT, MRD wrapping, and then sometimes, not always, LVA and then efferent can resolve this problem. But in the middle stage of the second stage or middle stage, it becomes fat hypertrophy, and then lots of lymph sludge, fat hypertrophy. This can be done by debulking procedure or liposuction, water-assisted liposuction, something like that. And then the final stage is subcutaneous fibrosis. There is no way, just only excision. And I'm doing in this stage the ESWT, extracorporeal shock wave treatment. So I always doing this is the suction procedure, lymphosuction or liposuction with regeneration of lymphatics. I use stem cells. So, and also adjuvant therapy, detoxification pathway. Detox therapy also very useful. So lymphosuction is, I suck out the lymph sludge mainly with the infusion of tumescent iosmolar saline solution, lymph washing concept. So liposuction and lymphosuction are a little bit different. So stem cell graft. Stem cell graft making a very small lymphatics under the subcutaneous tissue, and then the efferent concept is grafted of a normal lymph node to the lymphedema site, and LVA is just a connection to the lymph and then vein. But this is failed. And then stem cell therapy making a small lymphatics is okay, my thinking way. So stem cell, about the stem cell theory. I did, this is 49 female patients, is lasting more than 3 years with ulcer. And then I gave her the stem cell surrounding here, and then completely healed within 20 days. You see? So I can see the stem cell is very strong, very powerful to make